Hi, my name is Dr. Jeff Chapa, and I'm a maternal-fetal medicine specialist who's now the National Medical Director for Obtelecare for maternal-fetal medicine. So I was inspired to pursue a career in maternal-fetal medicine during my third year medical school clerkship in obstetrics and gynecology. I was really struggling with as to what I wanted to do. I didn't think I was quite going to be a surgeon, yet I didn't want to just be in the office all day as an internal medicine specialist. When it came to my OB rotation, I absolutely fell in love with delivering babies, and managing some of the more complicated cases seemed really appealing to me. And the whole thing seemed to fit with my personality very well. And then when I transitioned into my residency in obstetrics and gynecology, I just felt more comfortable on labor and delivery than in the operating room or in the office. And so naturally, I gravitated towards specialty training and a fellowship in maternal fetal medicine. I am extremely excited about joining Obtelecare as their National Director for Maternal Fetal Medicine. I think this is an incredible opportunity to really address disparities of care that exist in our country. Maternal fetal medicine services are extremely concentrated in large academic centers and in cities. So once you get outside of there into more rural areas, it's very hard to have access for services. I grew up in a small town in Pennsylvania, and I know the challenges with trying to access specialty care firsthand. I remember a close friend of mine growing up whose father was ill with significant heart disease, and he actually ended up having to have a heart transplant. And my friend was frequently missing school because he was traveling with their family to have his dad's healthcare needs attended to. So I remember from a very early age that, wow, it's really hard living in these small towns when you don't have the medical resources available to you, especially if you get sick. Access to maternal fetal medicine is really important for all patients. In the United States, we have a crisis with regards to maternal and infant mortality and serious morbidity. In fact, if you look at developed countries, our rates for maternal and infant mortality in the United States are higher than most any other country in the developed world. And a lot of that has to do with access and the way that resources are distributed across the country. A lot of times patients need maternal fetal medicine services to properly identify conditions that are affecting their pregnancy. And it's really important when there are conditions where delivery is better suited in a higher level facility like a tertiary center where there's pediatric subspecialties, or in the case of a condition like placenta accreta, we need a blood bank and appropriate surgical support for the patient. So it's really important that these patients have access to maternal fetal medicine so that their problems can be identified in a timely manner so that their delivery can be performed with all the resources that are going to be needed to help the patient. This avoids having a patient deliver an infant in a setting where we don't have the resources from a pediatric standpoint to take care of the patient or to take care of the infant. And then the infant would have to be transported, which adds to the risks and morbidity associated with their particular condition. Same thing for a mom who's ill or has a condition like a placenta accreta where they're at risk for hemorrhage. To deliver in a setting where there isn't adequate support surgically or a blood bank that's capable of handling a massive transfusion protocol, it's really imperative that those patients get seen in a facility where they have the appropriate resources. I think the impact for OB telecare as far as maternal and infant health outcomes is going to be that we're going to make a significant improvement by providing access to patients to maternal fetal medicine services where there wasn't previously an easy solution for them. I think this is going to improve patient compliance and the care that we're able to provide. and also timely identification of complications and getting the patients to the appropriate centers where their resources are available to effectively take care of them. The other thing I think that the Obtelecare concept will do is to really enhance collaboration across institutions. As telemedicine providers, we work with the patients in their particular hospitals where they're being seen, but then we must also work with the tertiary centers in that area. And this really brings the collaboration that's needed to take care of patients in a particular area. And I think that's going to be extremely important. Additionally, we are able to develop relationships through Obtelecare, not just with an individual hospital, but with an entire health system or an entire group of practices that are all working in the same area.